A microphone here. Good evening and welcome to the St. Louis Zoo. My name is Jim Jordan, Curator of Education, and before I make a couple of announcements, want to thank you all for coming out on a cold night, and we still have people coming in, so please, if there's any empty seats in the middle, can you move in? Otherwise, it's going to be very awkward during the program for people stepping over you. We have fire code. We can't just let people sit or stand at the exit. So if people don't mind moving into the center, it'll help accommodate everybody. Again, we have quite a few people that I know are still going to come. Thank you very much. For those of you just coming in, there's still some seats down in the front on either side. Okay. We've had an extraordinary year so far with the science seminar co-hosted with the Academy of Science and St. Louis Zoo, and I'm sure there's a number of CSI fans out here. Otherwise, why would you all be here, right? Well, before we get to tonight's program, I want to mention a couple other programs coming up. Next Wednesday evening, we have a free program here that's part of our zoo lecture series, and it's called The Buzz About Bees. Many of you have heard about some of the problems bees are facing, and as a result, the effects of lack of pollinators will have on not only our food crops, but other resources that we have. And in Missouri, it could result in billions of dollars worth of loss in agricultural products. Ed Spivak, the curator of invertebrates, will be conducting the program, and he has a special interest in native pollinators also. And that's a forgotten part. But native pollinators are also facing threats that our honeybees are. So come learn about native pollinators, colony collapse, and other threats to pollinators, and a little bit about maybe what you can do. Again, next Wednesday evening at 7:30 in the auditorium, and it's free. The next science seminar features Dr. John Rigdon, who is a physicist, and he has authored a book called Hydrogen, the Essential Element. Dr. Rigdon is going to talk about the Big Bang. Maybe we welcomed in the Big Bang over New Year's Eve, but this is a larger one, and how evidence from deuterium, heavy hydrogen, has helped provide more kind of facts or things to support the theory of the Big Bang. And then our last one in March, the Energy Environment Nexus, will be looking at how there are other forms of renewable energy that are coming on the horizon. And we all know that that's going to be a big push in our next 4 years. President-elect Obama has already been talking about the renewable energy scene and how it's going to be important to us. So we invite you back to both of those later on. And with this time, I'm going to introduce Rose Jansen with the Academy of Science.
Good evening. We're glad that you could join us tonight. This is a science seminar series that is a partnership with the St. Louis Zoo and the Academy of Science. And many of you are Academy members and friends and so are familiar with us. But for those of you who are not, I'd like to take just a moment to tell you a bit about whom we are. We're a local nonprofit that's been serving the St. Louis community and surrounding counties since 1856. We have a long-standing mission to advance the public understanding of science and inspire the next generation of scientists and science advocates. And we continue to celebrate more than 150 years of community service by offering a broad range of free and low-cost public science programming, collaborative seminar series, and trips and tours highlighting science at venues throughout the region. You can find more information on the Academy and our community-wide events and programs by visiting our website at academyofsciencestl.org or by picking up some of our literature just outside the auditorium on your way out. And if you'd like to receive e-notification of upcoming Academy and St. Louis Zoo public lectures and events, there will be e-news sign-up sheets that will make their way around the audience as well as outside the auditorium. So please feel free to jot down your email address and or snail mail address, and we'd be more than happy to let you know about upcoming events both here and at the St. Louis Zoo, and we don't share your name with any other organizations. Tonight's seminar, In the Wee Small Hours, A Life in Forensics, is the fourth in a lineup of very relevant and exciting 0809 Zoo Academy talks, and as Jim said, upcoming seminars include the Big Bang and Engineering Clean Energy. And again, you can find more information on the series on both the Academy and Zoo websites, or there are actually series brochures outside the auditorium available for you to take with you. I'm going to go ahead and introduce our speakers this evening, Dr. Mary Case and Dr. Christopher Long. Dr. Case is a professor of pathology and co-director of the Division of Forensic Pathology at St. Louis University Health Sciences Center and chief medical examiner of St. Louis, St. Charles, Jefferson, and Franklin counties. She is chair of the Missouri State Child Fatality Review Training Program and sits on the editorial board of the Journal of Forensic Sciences and the American Journal of Forensic Medicine and Pathology. Dr. Case is a graduate of the University of Missouri-Columbia and St. Louis University School of Medicine. She did a residency training in pathology at St. Louis University Health Sciences Center and was a postdoctoral fellow in neuropathology for the National Institute of Neurological Disease and Stroke. She is board certified in anatomic, forensic, and neuropathology. Dr. Case has a special interest and expertise in the areas of head injury in both children and adults and in the area of child abuse. Dr. Long is director of the Forensic and Environmental Toxicology Laboratory at St. Louis University and is an associate professor in the Department of Pathology, also at St. Louis University. He directs the toxicology laboratories of several counties for the state of Missouri and is a member of the American Academy of Forensic Sciences and the Society of Forensic Toxicologists. Dr. Long has been involved in the toxicologic analyses of specimens in several mass disasters. We are very pleased to have Drs. Case and Long here with us tonight to talk about their work in forensics. So on behalf of the Academy of Science St. Louis and the St. Louis Zoo, won't you please welcome our first speaker, Dr. Mary Case.
Is this working? Yes. Okay, because I thought when it was red it was off. Well, good evening. I'm very delighted to be here, and I'm just amazed that so many people would come out on such a cold evening to talk about forensic sciences. So I hope that we do satisfy you in telling you a little bit about what it is we do, at least in the medical examiner's office and in the toxicology laboratory. What I'm going to do tonight is tell you a little bit about the medical examiner system, and then at the very end I am going to show you a case. And I'm not going to show any awful pictures, I'm not going to show anything gory, so don't get your hopes up or don't get upset. It won't be anything bad. But let me just start out by telling you what the medical examiner's system is. Every state in this country has to have a law that regulates what you do with dead people that society is interested in, people that we want to know why that individual has died. There are certain classes of people that we want to know why they have died. So the jurisdiction of these death decisions, the death investigation, falls into either a coroner or a medical examiner jurisdiction. In the state of Missouri, we have a mixed type of system. In the small counties, we have coroners. Coroners are lay individuals. They have to be 21 years of age. There is no particular educational requirement. They get elected to office, and all of a sudden they're in charge of determining why people die and a lot of other things. In the larger counties like St. Louis, St. Charles, Jefferson, Franklin counties, the city of St. Louis, Kansas City, Columbia, Springfield, we have medical examiners. And the medical examiner is an office that has been created using forensic pathologists. And forensic pathology is a specialty within medicine. So we are doctors, and then after getting out of medical school, we do a 4-year residency in pathology, followed by a year of fellowship in forensic pathology. So it's a specialty that is created particularly to do the work of the medical examiner. Currently, there are about 400 board-certified forensic pathologists in the entire country. That's not very many. We need twice that many, which doesn't seem like a whole lot, but the number that we have now doesn't really help us with a lot of dead people. There are many that kind of fall through the cracks. Now, I don't want to say that. Let's just say their deaths may not be appropriately investigated. Probably 50% of the population of this country is in a jurisdiction where death investigation is done so poorly that if it happened to you and your family, you would be appalled, and yet people are not aware of it until it does happen to them. So who are these people that the medical examiner is concerned with? In a very broad sense, you could say that it is people that are dying suddenly, unexpectedly, by possibly unnatural causes of death. So that would include homicide, suicide, accidents. That makes a lot of sense. But there are a lot of other people that die that are not unnatural deaths. They are natural deaths, but because of their age or their circumstances, society wants to know why those individuals have died. And to give you some examples of who these people are, I'm going to talk about that for the next few minutes. There are people that die suddenly when they're in apparently good health that we want to know why that is. For example, somebody might die after they've had a very rapidly fatal disease, like meningitis. Somebody needs to have the jurisdiction to autopsy that individual, and that jurisdiction is given to the medical examiner to do that. We do not need family permission, so I will autopsy that individual, and if I didn't do that, other people might be endangered because contacts of that individual may need to be treated. So that's why we need to have laws that prescribe that certain people who may be a risk of an epidemic illness would be given to the jurisdiction of the medical examiner. People that die in public places, those individuals, when they die, they're reported to the medical examiner and we investigate their deaths. There may be something dangerous about that particular location that we need to make sure they're not being electrocuted or they're not having some kind of trauma done to them. All maternal deaths are investigated by the medical examiner. Maternal deaths, obviously, these are young women, and we want to make sure that we know exactly why those individuals have died to the best that we can determine. We autopsy and investigate people that have died outside of medical facilities where there is not a doctor that is going to be responsible for certifying their deaths. This is just an example of a brain in a case of very suppurative meningitis in a young child that I did recently. The cause of it was Streptococcus pneumo, and so it's not going to be a disease that the contacts are going to be needing to be treated. But if it had been certain other types of diseases, that would be information that we would need to know. So this is just a nice example to see of meningitis. Some other types of deaths that we investigate involved trauma by thermal, chemical, electrical, or radiation energy. Drugs, medications, poisons, chemicals. Dr. Long will talk to you in great detail about his investigation of these types of materials and tell you how his operation works. The medical examiner is going to investigate cases that are related to trauma regardless of when the individuals die. For example, if you are in a motor vehicle accident and you become injured in a way that then debilitates you and 20 years down the road you die, and there is some relationship to your dying. Maybe you have a urinary tract infection because you have been quadriplegic as a result of that motor vehicle accident. We will investigate that and we will certify the death going back 20 years. The cause of death will be on the death certificate related back to that old injury. If it's something that was traumatically induced by another person, it could be a homicide 20 years later, 30 years later. So there is no statute of limitations on the timing with which we do our investigations, unlike prosecution. We investigate people that have died by blows and mechanical trauma, cutting and stabbing, firearms of all types, explosions, and that's pretty self-explanatory. Asphyxia is a big category of deaths that we see a lot of, and by asphyxia we mean something that keeps the oxygen from reaching the bloodstream so it can be delivered to the body. So you could do this through strangulation when there is pressure applied to the neck. You can also do it what we call traumatic and positional asphyxia. Traumatic or compression asphyxia is when you squeeze on somebody's chest. For example, rarely you see this, but occasionally we will have a boa constrictor snake that squeezes on somebody, and that is what we consider compression or traumatic asphyxiation. That is also what happens if somebody's under a car and the car is up on a jack and the car comes down and lands on your chest. If you can't excurse your chest, you can't breathe, and we consider that traumatic asphyxiation. Positional asphyxia is if you get into a position that interferes with your breathing. To some extent, crucifixion is a positional asphyxia. You're in a position where you can't, your diaphragm will fatigue and you can't continue breathing. If you're hanging upside down, drunk people that go over a fence and get hung up on their pant leg upside down, those individuals will die eventually from positional asphyxia. So these are strange things you may not think about. Drowning is a cause of asphyxiation. Hanging is an asphyxial death. Gases like carbon monoxide are asphyxial deaths. Smothering is what we refer to if you place, occlude somebody's nose or mouth, or you put a gag into the mouth. So these are asphyxial types of death. And then there's a huge category of vehicular accidents of all types, and we have lots and lots of those. Weather-related incidents, we have both hyperthermia, where people are exposed to hot environments. We also have hypothermia, which, for example, tonight, if somebody gets outside, an elderly person gets out and gets locked out of their house, or an intoxicated person passes out on the porch, it wouldn't take very long in this cold weather for them to die of hypothermia. Tornadoes and hurricanes, those kinds of disasters, flooding, lightning, anything weather-related, we are going to investigate those deaths. This is a photograph I have from the Highway Patrol. This was the tornado that came down over Sedalia last year, and it's a beautiful tornado cloud. We don't see pictures like that very often, so I had to stick it in there. Now, some things that you might not think about, people that need to be investigated, are deaths that occur under anesthesia. If you go into the hospital and you're given anesthesia and you don't wake up from anesthesia, those deaths are going to be investigated by the medical examiner. If you die during a surgical procedure or while you're having any kind of diagnostic procedure, if they're doing some kind of testing on you, we want to make sure that something hasn't gone wrong, that it's not like we're checking up on the doctor necessarily, but in a way we're trying to make sure that nothing has gone wrong there, that we can determine that everybody will be protected. We investigate deaths that have to do with employment, either past employment or the present employment. And the reason for that is to make sure that there are not dangerous places of employment. And there have been, and the way that those places of danger come to the attention of the public is by the medical examiner arousing the interest that, well, this is a dangerous place to work, we need to change certain things. And there have been any numbers of circumstances where it is the medical examiner who alerts the public to certain dangers. Right now, for example, how many of you know what sudden infant death is? A lot of young babies in the first year of life in this country, 3,000 or 4,000 babies a year die from sudden infant death. And we would just say we don't know why those individuals are dying. We do an autopsy, we do toxicology, we do all kinds of investigation, and we cannot determine why they had died. But what we do know, and that has come out of medical examiner investigations, is 80% of those babies are dying from unsafe sleeping, and they are entirely preventable. They are sleeping in an area where their air is restricted so that they're not breathing in and out fresh air. So they could be positioned down on a billowy surface, or they could be, for example, in an adult bed, or they could be co-sleeping with individuals. These are entirely preventable deaths, and so the medical examiner currently is involved in a big educational program to try to prevent those kinds of deaths. So that's a common thing that the medical examiner does. Remember, we are in the public health arena. We are part of the health department in St. Louis County, and our overall purpose is to safeguard the public health, and we do it by investigating all of these deaths. We have some special categories of people that we will always investigate their deaths. For example, all children under the age of 18 in this state, they get very thorough death investigations, just the fact that they are children. We have a special law that prescribes exactly the need to do that. And there are only certain pathologists in the state who can autopsy those children when they die. Now, these are children not dying from natural diseases. I'm talking about a child who appears to be perfectly healthy and is not dying at a particular time from a known cause. So every one of those children under the age of 18 will get a very thorough investigation. Another category that is very closely looked at are individuals who are in the custody of the law. And I'm talking about somebody that is in the process of being arrested, maybe it's just a traffic stop, or they are in jail or they're in prison. These are individuals that if they die, and we do not do very thorough investigations and autopsies on those individuals, the family may claim that there has been brutality, and there may be brutality. So we want to protect both the police and the family. So we do very thorough autopsies, and in those particular cases, we do additional studies that we don't do on just an ordinary autopsy. There are parts of the body that can be injured that you might not see from the external surface, and that even when you do a regular autopsy, you would not see those kinds of injuries. For example, in the buttocks, there's a lot of fat, and you can have very deep injury there. So we have to dissect and kind of skin the people and do these very specialized invasive procedures in individuals where there may be allegations of brutality. We would also do that where there might be allegations of violations of human rights. For example, if we had a terrorism event, we might investigate those kinds of deaths in the same way. People that die at home or under the care of other people, they fall into special categories. We may not bring all of those people in and autopsy them because we simply can't, but we are going to investigate those deaths. All nursing home deaths are reported to us, and this is a huge burden. This is a new law that has come up in the last few years, but because there is a need to make sure that these individuals under the care of other people are not having something done to them that might cause their death. And those at home, when somebody is found dead at home, you can't just take that body to the funeral home and bury it. We need to investigate it. The medical examiner signs many of those death certificates, certainly without an autopsy, but they are investigated to, as well as we can, assure that nothing unusual has happened. Newborns delivered outside of medical facilities, that happens more than you would think. When those individuals die, we investigate those very thoroughly. Number one, we want to make sure, is it a live-born or a stillborn? And we want to see whether or not someone has done something to cause their death. Anatomic materials. A bone is found. A dog brings in the bone, and they call the police. Well, we get that bone. We get everything that is brought into the police. They don't know what to do with the bone. We want to know, is that a human bone or is it a deer bone? If it's a human bone, then we have our special helpers, the forensic anthropologist, and they will identify and deal with those kinds of materials. So when we're doing and looking at all these individuals, what is it that we are trying to determine? Well, we're trying to determine what the cause of death is. That's our mission. Why did that person die? For example, a gunshot wound to the chest is a cause of death. We also want to know the manner of death. How did the cause of death come into being? Was it a homicide, a suicide, an accident, a natural, or sometimes we can't tell and we call that undetermined. In the case of a gunshot wound, that could be a homicide, it could be a suicide, it could be an accident. So how do we tell that? Well, we look at the injury, but we also have to look at the circumstances. We have to know everything about the circumstances, and that will tell us a lot about whether, for example, a gunshot wound is an accident. Rarely do we ever call a gunshot wound an accident. You almost have to have something wrong with a gun. Even if a child apparently accidentally shoots another child, we don't consider that an accident. We call that a homicide. To the medical examiner, a homicide just means that one person has caused the death of another. So we use that in almost all gunshot wounds. Very, very, very few of them are accidents. We have many suicide, obviously, gunshot wounds. Now, other things that we want to look at when we're examining and investigating the death, and particularly with an autopsy, is things like the identity of the individual, things like time of death, how long has the individual been dead, things like what was the disability, what would this person be able to do after they were injured, that stab wound in the heart, could they walk across the floor, because this is what this particular witness said, and we want to be able to verify that. So we actually have information on all kinds of lethal injuries, how long you could live, what would cause you to become instantaneously dead. We want to know the pathophysiology of what the injuries are. Now, just to mention a few little words that you may have heard these words, and I'll just kind of real briefly tell you a little bit about them. Things that happen after death. Rigor mortis, that's the stiffening that you hear about. That occurs after death because of changes that occur chemically within the muscle. It begins very shortly after you die, and within 4 to 6 to 8 hours, certainly by 12 hours, that rigor is fixed, and it will stay there for another 24 hours, and then by 36 to 48 hours, it begins passing off. So that helps us a little bit determine how long a person's been dead. Livor mortis is the kind of just by gravity, blood will flow down to wherever the dependent portion of the body is. Most people, when you're dead, you're laying, you're not standing up. So if you're laying on your back, the back of your body will begin to look kind of purple. And that will occur very rapidly after you die. And by 8 to 12 hours, that becomes fixed so that if you push on it, it doesn't kind of go away. And the positioning of that livor may tell us, for example, maybe the information is that the person was found face down and yet the livor is the opposite. That may help us in certain death investigations. Decomposition refers to the breakdown of the body, just decomposing of the body. It's a result of putrefaction, which is the bacterial action that goes on, as well as autolysis, which is the natural chemical breakdown of the body that is ongoing commonly within the living body, just a dead tissue. So that can happen, and those two processes cause the body to break down. Exhumation refers to what we do if we dig up a body that has been buried, and then we examine that body. And that's not really uncommon. When a body is embalmed, it will stay good for a long time. So that is not an uncommon thing to do. We have some special helpers within the forensic sciences. The forensic entomologist, those are people that study insects. For example, larvae that get into the process of decomposition. That can help us very greatly in determining how long somebody has been dead. By looking at their instars, their developmental processes, we can tell almost precisely how long somebody has been dead. We can also use those insects to test for toxicology and see what that dead person had been using, and we may be able to tell why that person was dead by analyzing the maggots, as strange as that might seem. Forensic anthropology, I mentioned that before. Those are the special scientists that study bones, and they can tell age, sex, height, weight. They can tell diseases. They can tell how old that bone is, how long ago the person died. Huge help to the forensic pathologist. That man, that is an exhumation. He's in very good shape. He's got some little patches of mold on him. That is a very common thing to see. Identification, how do we do that? Well, we do it in a number of ways. First of all, is it human or non-human? If it's not human, I don't really care what it is. If it's human, then I want to know. One of the ways we can identify people is visually. We can look at their license, their driver's license, and say, yeah, that's that person. So that is a non-scientific identification. For scientific purposes, we have fingerprints, DNA, and radiology, where we look at x-rays of the dead person, like the skull, and then we look at a antemortem x-ray when they were living, and we can compare bones. And there are enough differences that we can use those to scientifically identify individuals. So those are scientific identifications. Circumstantial identification is a house burns down and somebody knew who lived in there, and there's a body in there and that person doesn't show up anymore. By circumstances, you could say, well, that's who that is. We don't like to do that, and that is a very unacceptable type of identification. Forensic anthropology, I've mentioned, I won't talk about that again. We also have forensic odontologists. Those are the dentists that help us, for example, in a mass disaster. They are very active in those disasters, but they help us with fire victims and people that are heavily traumatized to make the identifications. Now, I'm going to switch over here and show you just very briefly a case, if I can get over there, and talk a little bit about, so you can see how we work. This is about a skull. This happened a long time ago. In October of 1986, there was a man who was from Sweden. He was doing what they call orienteering, where they go by maps and they go through the woods. And so he was going through the woods and he found a human skull. And he was going back to his country, so he didn't want to get involved with the police. So he just put on his map where that skull was. He left it there and he went back to his country. He wrote to the police and he said, I know where there's a human skull. And he told them, and they went there and they found the skull. Now, when you find a human skull, they always try to find if there are other bones. Now, remember, this is back in 1983, and this skull was actually found on a Boy Scout ranch. They did look around to see if they could find any other bones, and they couldn't find any, and they were not using, at that time, an anthropologist. A forensic anthropologist would actually know where to look for the bones. They would excavate, and they would know if there was an animal activity in the area. They would know where those animals would take those bones to. It's really, really neat the way they can excavate and do the things that they do. The police, now this is 1983, they didn't know what to do, so they just kind of set on this. This occurred down in the Farmington area, it was Washington County. It's a coroner jurisdiction, and they certainly didn't have anybody to assist them. So several years went by, and finally they were able to get a forensic anthropologist. I currently have a forensic anthropologist who works as one of my investigators, so she's full-time there. My first forensic anthropologist came in 1995. There were none in the state of Missouri. This anthropologist came from Colorado, and he came out and he worked on this case. And he was able to determine that it was a female, it was a recently dead person, meaning it's not an Indian artifact, it's not something that goes back several hundred years. It was a current death. And she was in her early 30s, and she was of Southeastern Asian origin. They also did a facial reconstruction. Now, this is a very interesting process where they have studied the thickness of the flesh on different parts of the skull, and then they can put clay to those they put little tacks on there, and then they put the various thicknesses of clay on there, and they can recreate from the skull. They mold the clay on there, and they recreate the face. So here's the skull, and you can see the top I've cut. This is later it is brought to me, and I'll explain that. But the top where it's been cut, I did the cutting, so that's not some kind of an injury. So this is a lady in her 30s. She's of Southeastern Asia, and they can tell that by how delicate the bones are. The women have much more delicate bones in their brow ridges, their jaws, their cheeks. The shape of the orbit of the eye can tell you the Asian origin as opposed to Caucasian or other types of origin. The size is important. Here's the left side, here's the right side. Notice the initials that the anthropologist put the initials on there. That didn't come like that. So here's the facial reconstruction. And so what do you do then with this? How do you find somebody? Well, you put this picture in the paper and you say, does anybody know this person? And sure enough, somebody came up and they said that they thought that this was their friend. And they said, I think that this is Bungie Niehaus. And Bungie had come to this country from Thailand. She had married a man who had been in the service in Thailand, Richard Niehaus, who lived over in St. Charles. So the police in St. Charles now, they go to that home and they say, where's Bungie? And the husband said, well, Bungie left a few years ago and went back to Thailand. So they were able to get dental records on this lady, and they were able to identify, using forensic odontology, that in fact this was Bungie. So Bungie didn't go back to Thailand. She's right there. Now, after they had identified the skull, I was asked to look at it because now, remember, several years have gone by. This is in a county where they didn't have many facilities, and now it has come into St. Charles, and a number of people are looking at it. So what I was able to tell was that there is a skull fracture, there is an injury, and I'll show you what that looks like. It is an injury that is an antemortem injury. It is right there this is what we call the occipital area, the back of the head. There is kind of a little indentation. This is a fracture. It's actually in the left parietal. I don't know why I'm getting louder. Does it seem louder? How's that? I can't tell if that's turning it down. This is in the left parietal region. It's just to the left of the midline. How's that? I can't tell if it's helping any. Is it louder? Okay, what about that one? Okay, well, let me see if I can move this. How's that? A little bit better. Okay, so there is a depressed fracture. It is this has been made, for example, by a hammer or something, where there's a very sharp, concerted area of force, large amount of force that is discretely focused on that area. It's not something that is spread over a wide area. Now, I can tell by looking inside the cranial cavity that this has caused an indentation, and there's bone on the inner table. I can tell you that. But he also told another story, and that was she wasn't dead, but she was injured, and he knew he was going to get in trouble. So he then suffocated her. Now, you guys out there, if you have a fight with your wife, she falls down, do not do this. This is not good. But he has a dead body, you know, and so he has to decide, what do I do now? So he wraps her in a plastic bag and he puts her in the freezer. And in December of 1983, it was a winter like this. It was really, really cold, except there was snow on the ground, and he was not able to bury the body. So he kept her in that freezer for 4 months. He had 2 children. They ate food out of that freezer. He told his children that the mother had gone back to Thailand. And then when it got warm enough, he took the body out to the Boy Scout ranch and he buried her. So that's not a good story. You know, that will get you into trouble every time. Always call 911. He was tried in 1992 on first-degree murder, and the jury deliberated for 2 hours. So this didn't take them very long. Even in real terrible crimes, you know, they usually deliberate for several hours. So 2 hours is really, really short time. They convicted him. He's still in prison. He got a life sentence, and there's the newspaper article and the lady. And this is public knowledge. I'm not telling any secrets. This has been on television. This is one of the forensic file cases, and it's obviously open to public record. So that is a forensic case that's been on TV, and I thought it would be interesting to show it to you. I'm going to stop now so we can get on with the next part of the program, but I thank you very much for your attention, and I think after Dr. Long, then we will be having questions.
Hello? Does this work? Now, let's see if this works. Well, I'm a toxicologist, and basically we study poisons. And it wasn't that long ago, I had a meeting, I was with a bunch of other people, and the guy said, "By the way, what do you do for a living?" I said, "Oh, I'm a toxicologist." He goes, "Oh, wow, you stuff animals." So you got to have a sense of humor in life. Toxicology is really the study of harmful effects of drugs and chemicals on living systems. And there's a lot of different areas of toxicology. For example, environmental, where we have dumping of chemical waste into the aquifer, and people end up drinking it, so you're exposed that way. There's also product safety, like you're wearing clothing that has different colors on it. Well, the dye in the clothing, suppose that was transdermal. That is, it would go through the skin into your system and have an effect. A friend of mine worked for Avon, and he had a very good cologne for men. It was terrific, smelled really great. And you'd put it on, and it was one of the most potent neurotoxins you could ever run into. So I have a couple bottles for my friends. And then the pharmaceutical. And of course, this is the area where you have drugs coming out. They have to have hundreds of drugs coming out almost on a daily basis. So what do these drugs do, and as far as the toxicology of it? With all drugs, there's what's called a risk-to-benefit ratio. Okay, for example, you take an aspirin for a headache. That's fine. But suppose the aspirin gave you cancer. Is it worth doing? No, it isn't. So you have to have a balance. There's a risk-benefit ratio on all of that. And of course, you'll see that with a lot of the drugs. Even, for example, alcohol on a risk-benefit ratio. Alcohol produces effects, but it does kill brain cells. So there's a trade-off there. And of course, the area that I'm in is forensics. Forensics means pertaining to a court of law. So what we do, the data may be admitted into a court of law. And this gets into a lot of very interesting stuff. Yes, and I am the one they call Dr. Long. Okay, the forensic toxicology studies the drugs and substances that people use and abuse in a manner that the data may be admitted into a court of law. So we focus in on the drugs. For example, people take antidepressants because their brain chemistry is off, it's out of balance. So we'll study those. We'll study, of course, alcohol. We'll study the drugs and substances that people use and abuse, the drugs of abuse. We'll study the fun drugs like ecstasy, which I'm going to talk about a little bit. Toxicology itself is a hybrid science. That is to say, it isn't, like chemistry, for example, is very clear-cut. Chemistry you have straightforward. Toxicology is a composite of chemistry and biology. In chemistry you have you have biochemistry, which is primarily the basis of it. Because your body is a series of chemical reactions. How it works is just one reaction after another. Even something like carbon monoxide. Now, I'm sure you've heard in the news about people, excuse me, I got a cough, so. People that there's a fire or a furnace or something happens and they have carbon monoxide poisoning. Well, carbon monoxide, and you think about it, well, it displaces the oxygen in the hemoglobin group. Hemoglobin, of course, carries the oxygen to the cells from your lungs. Well, carbon monoxide displaces that, so you don't get the oxygen. But the real problem with carbon monoxide is what's called on a cellular level. Because once the oxygen gets down onto a cell, okay, such as a heart cell, okay, once it gets down there, your cell needs energy, so it has what's called a cytochrome system. Cytochrome means it's a colored protein, basically. So it carries the oxygen down so that it can generate energy and do its job. Carbon monoxide interferes with that, or it stops it. So no matter how much oxygen you get, you still expire. So this is the biochemistry of it. There's also analytical chemistry, because in order to find out if it's carbon monoxide, you have to be able to identify carbon monoxide. And how you're going to do that. And of course, then there's a whole series of drugs like heroin, its metabolite, morphine, codeine, hydrocodone, oxycodone, and so forth. As far as the biology side of it, you have the anatomy. Well, that's pretty obvious, isn't it? If you find a drug present in the blood, it tells you one thing. If you find it in the brain or the liver, it tells you something else. And you also have to look at the particular parts of the circulatory system, whether it's an artery or a vein, because there's differences. Arteries pump blood from the heart out to the body, and veins return it. So a vein will have a lower concentration than an artery. And arteries are subject to what's called post-mortem redistribution. What that means is, when you take a drug, for example, it doesn't know, say you take an aspirin, it doesn't know that it's your head that it's supposed to work on. Okay, it doesn't know that that's where the pain is. So what it does is it goes throughout your entire body. And one of the areas is like the heart muscle. Now this is an energy requiring step. So as long as you're alive, you have the energy to do it. What happens is once you expire, there is no more energy. So all the drug that has been pushed off into the tissues now comes rushing out into the blood, and you get an artificially elevated blood concentration. This is what's called post-mortem redistribution. The body's actually changing the drug concentration. And of course, it goes into physiology and pathology. Pathology is really the structure. So when you can see the changes, and a lot of times you can't see changes, such as in an arrhythmia. You can't see it. A lot of the drugs do produce arrhythmias. Arrhythmia is an abnormal heartbeat. So the drug will induce that. You'll have a heart attack and expire, and there really will be little, if any, evidence of that. What we do as far as a job description is we analyze materials, the mud, the blood, and the beer. Yes. So you have to realize, people may want to see you, they may really want to see you, but they die to see us. So anyway, we do the biologicals, the blood, the urine, and various tissues. Inhalants, they were very popular back away as they come in and out of cycles, they fall in and out of favor. There's also drugs and poisonous materials, and I hope I have the slide coming up. Then the next part is, what do these results mean? For example, GHB. Okay, it's a drug used in date rapes, gamma hydroxybutyrate, called Georgia Homeboy. It is a super alcohol, and I'm going to talk about it some more. Every one of you in here has some of that in you right now. Okay, GHB. It's part of a normal biochemical composite to the human system. So the difference is, can you distinguish between what's normal and what's abnormal? Was this somebody abusing the drug or not? And of course, then you have to get into the legal system, which is deposition and trials. And you got to have a sense of humor. The whole question for the toxicologist is, was it a poisoning? This is a book by Irv Sunshine. It's a pretty good textbook. Yes. Here's an example. Was it a poison? This gentleman made a cake for his girlfriend, and he put a little stuff in it here. And I don't know if you can see it too well. It's actually rat poison. Yeah, he's not doing too well right now. As far as the analytical chemistry side, you see on CSI, and I have to tell you, back when I was growing up, it was Quincy. Yes. And Quincy, oh, mercy. But anyway, Now it's CSI, and they're not much different. You know, they have the guy up there, and he's working on the screen on TV and so forth. You know, and they can pick up phone calls and all the rest of this. Nobody can do this work. Nobody. I had a woman call up, and she goes, well, I think somebody poisoned my father. I said, okay. She goes, but he was cremated. I said, well, there's not much we can do then. She goes, well, I have 6 chest hairs. It gets better. So, the 6 chest hairs, I said, well, there's not much we can do with that. And she goes, well, on TV they can. And I said, well, they have pigs fly on TV too, so what? You got to have a sense of humor. But a lot of this is very sophisticated instrumentation. So it's very strong in analytical chemistry because you have to decide, you have to understand what the instrument is actually measuring. We had a case just south of here, okay, where the wife allegedly, okay, said to the husband, oh, you know, she worked at the church. I left the door open as he's climbing into bed. And she said, well, I left the door open. I better go get it. He goes, okay, honey, bye-bye. Okay, and the next morning he wakes up and she's not there. He says, oh my, right? So he calls the police. Lo and behold, they find her car, drove off the road, hit a tree. Oh my, I'm a poor widower. My wife had a motor vehicle accident. Well, there's only one problem, and this goes into Mary's area. You can't die from a trauma unless you bleed, you know? And she wasn't bleeding. No internal, no external bleeding, meaning she was dead before the crash. Now, the pathologist involved assumed, and you know the derivative of that word, to assume, that this was a straight motor vehicle. So he didn't take a lot of blood or tissues, only took about 10 cc's. So anyway, her husband, as it turns out, worked for a chemical company doing research and development. So he could order anything in the book. And I don't know if you're familiar with the Merck Index. It's about this thick, has about 100,000 chemicals in it. Okay, most of them quite fatal to humans. Okay, so there was that. He had a book of natural poisons in his trunk. Oh, yes, this gets good. And his girlfriend was a nurse. And we had a total of 10 cc's, which is about a third of a shot of whiskey to work with, which isn't very much. So, of course, none of the drugs were present. So on a long shot, we tested it for insulin. Okay, insulin, you need it because you have sugar. Your beta cells produce insulin. It's out there. It's also what's called a C-peptide, which is the precursor to forming insulin. And what happened? We got a 0. Now, that's not possible. It isn't possible to have a 0 insulin. Well, what does that mean? That means something was interfering with the test. The test wasn't giving you a true answer. What we believe is he used a salt like potassium chloride and injected her with that, because that would cause, insulin's a very big molecule. It's what's called a quaternary structured protein, meaning it's got multiple strands and it's a big molecule. And it's held up there by ionic and van der Waals forces and so forth. And what happens with the salt is it flattens it out. So it would give you a 0 insulin. He's also in jail now, another member of my fan club. And there's some other stuff here, the liquid chromatography. Chromatography means separation. So if you hear gas chromatography, it means separation in a gas phase. Liquid means separation in a liquid phase. And gas chromatography, so you get the separation, then you have to have some way of analyzing it. And one is called flame ionization, which means basically you can burn it. You can't burn like argon or nitrogen. You can burn ethanol, you can burn hydrogen, you can burn a lot of other things. So it depends on the nature of the molecule. There's also what's called a nitrogen phosphorus detector. This is where it's 5,000 times more sensitive to nitrogen than it is to carbon. And guess what? The drugs have nitrogen, so this is a good thing for us. So we get to pick up nitrogen compounds. And then, of course, there's mass spectroscopy. Mass spectroscopy, you have the separation, and then the molecule, like my hand here, is introduced into the mass spectrometer. It's hit with very high energy, and it causes it to explode. That gives you the fingerprint. That's how you actually analyze the drug in mass spectroscopy. There's also the immunoassays. The immunoassays are basically an allergic reaction in a test tube. It's like you're allergic to grassy mold, okay, but you're not allergic to oak trees. Same thing happens in the test tube. If the allergic reaction occurs, it'll give you a class of compounds, such as amphetamines, or opiates, or the sedatives, the barbiturates. And then, of course, there's atomic absorption, which is metals. This is acute lead toxicity. You got to have, this is actually the St. Valentine's Day Massacre. I did a tour of duty with the Illinois State Police. I worked for them for a couple of years. And this is actually the St. Valentine's Day Massacre. And if you're ever interested in history, this is beautiful stuff. This just gives you an idea about our history as far as a culture. Now, this is Bayer aspirin, and we used to have this stuff here called heroin in the Bayer aspirin. I'm sure you've heard Coca-Cola having cocaine. Well, it was true. The pause that refreshes. Yep. Oh. Now, we do a lot of the DUI prosecution. Okay, and invariably you hear the guy staggering up there and so forth. He's got like a 200 alcohol, said, I only had 2 beers. I don't care, even if it's true. You're better off telling them you had a 6-pack, because nobody's going to believe 2 beers. Oh, see, now there's hope for me. Alcohol may ward off dementia. Now, this is an example of how science can be twisted. See, within a reasonable degree of scientific certainty, I can prove to you I'm a woman. It's true. We have, compare, skin, hair, eyes, nose, mouth, liver, kidneys, spleen, brain. Look at all the organs and tissues that are the same. Over 90% of the organs are the same, right? Well, within a 90th percentile, wouldn't you say within a reasonable degree of certainty I'm a woman? Exactly. Now, there's a perfect example of how science can be twisted. Perfect example. And, I mean, you could argue the point, but I'd get in trouble walking in the ladies' room. Now, this shows you what happens when you drink alcohol. Okay, when alcohol is consumed, I don't have a long enough arm. As you can see, it goes straight up, and then at the top there's that little redistribution. This is assuming an empty stomach, so the alcohol goes in. Alcohol is not readily absorbed from the stomach. It's absorbed from the intestines. Hence the story when you're back in college and so forth, not high school. Say, drink milk or have something to eat before you go out and go drinking. The reason for that is it kept the alcohol in the stomach longer. The longer it stays in there, the slower the absorption. On an empty stomach, it goes in real quick and it'll spike. And then you have what's called the elimination here. You notice it's a straight line elimination. This is actually called a beta elimination, or zero order kinetics. Yes, we're getting into some fancy words here. But anyway, if you notice the top peak there where it reorganizes, okay, the alcohol's absorbed, then there's a point where the body, it goes from the stomach into the blood, and it's going to the tissues, and it's working its way out for distribution. Well, it's believed that that hits what's called a CTZ, or the chemoreceptor trigger zone. And when the chemoreceptor trigger zone, that button is pushed, yes, you worship the porcelain altar. This is a pretty little white flower, isn't it? This is a great little plant. This is cocaine. Yes. Cocaine is one of the most unusual drugs. Back in the 80s, okay, nobody believed that you could get addicted to a stimulant. Cocaine is a stimulant. Boy, did we know a lot back then, didn't we? Enough said. Okay, so this is actually what happens is they take the coca leaves. This is a pre-step to it. One of the following steps is they take one of those big 55-gallon drums, they cut it north and south, they lay it down, they pour gasoline in it. Gasoline is a terrific organic solvent, okay? They then put the coca leaves in there, and they get somebody with a good case of athlete's foot to go in there. It gives it flavor. So they go in there and they stomp on it, right? Because that extracts the cocaine out of the coca leaves. They then pour it over and they add hydrochloric acid to it, or muriatic acid. You can buy it for about $5 a gallon. Okay, that causes the cocaine to precipitate out as a crystal. And then they bring it into this country, and then they convert it over to the free base, which means you take the hydrochloride off it and you make it just cocaine base. Well, why do they bother to add the hydrochloric acid if they're going to sell it as cocaine freebase? The reason is Americans buy cocaine based on weight. So you're paying $200 and $250 a gram for hydrochloric acid. Yes, huge markup. This is one of the ways it's brought into the country. And if you'll pay attention on the top left, the runt of the litter, okay? What would happen is they would take somebody and say, we'll pay you $10,000 to go down to South America and do this. So they go down there with a bunch of condoms, which is what these are, and they go down and they'd fill it with cocaine, tie it off, drop it in a second cocaine, in a second condom, tie it off, and then swallow it. They'd walk through customs. Go ahead, search me. You know, there's nothing there. Of course, they couldn't find it. Of course, the problem comes in. Now, from South America to, say, New or even Miami is about 22 hours in the air, which means if you're packing this much cocaine, and this was out of one person, by the way. Yes. If you're packing this much cocaine and you get caught, by the time you get out, you're going to be grayer than I am, okay? So you may get a nervous stomach. It may start churning. And what happens is these actually contain 20 to 30 grams, which is the equivalent of a shot, okay, of whiskey. 20 to 30 grams of cocaine. And it gets dumped into your system. There's nothing. There's no shimmies, there's no shakes. You're just sitting there, your time card is punched. You just go, and you're out of here. And that's how we found it, because when came time to get off the plane, Joe, wake up, Joe. Joe wouldn't wake up. And this is what they found in it. Now they use plastic, so it doesn't. It's estimated that on every flight landing in JFK in New York, there's 3 body packers carrying cocaine like this. Oh, by the way, once they came into the country, they'd take a laxative. They'd go to a motel, take a laxative, and collect these and sell it as USP grade. Now, with cocaine, I'll tell you what, I may finish up with this one. There's 4 parts of cocaine. It's cocaine, the drug. It's 2 metabolites, methyladenine and benzylecgonine. Again, coming back to chemistry. And there's a product called cocaethylene. See, when you do cocaine, it's a stimulant. It's good. It's really, really good stimulant. Produces a lot of really desired effects. So much so you say, I got to do that again, and you're hooked. But the problem comes in is as good as the high is, when you start coming down, you're cranky, you're irritable, you're really in a very angry mood. It's called a jagged edge. So what do? Well, they take depressants with it. One of the most notable depressants is alcohol. The thing is, alcohol and cocaine, your body doesn't know, and this comes to biochemistry, so it takes these 2 and it makes a new compound called cocaethylene. Okay? This is what happens when you do cocaine plus alcohol. And cocaethylene has a longer half-life, meaning it stays in your body longer. Half-life means if, say, I have X drug concentration in my blood, a half-life later I have 1/2 of that, a half-life later I have 1/2 of that, or 1/4 of the original, and so on down the line. Cocaethylene hangs around longer and has at least the same effect as cocaine. And this is the half-life. Cocaine's half-life is about a half hour. So you would figure five half-lives, or 2.5, 3 hours, the cocaine would be out of your blood. That's important. Here's a case history, and I'll finish up with this because I see we're running out of time. But anyway, 25-year-old female. Okay, her boyfriend brings her into the ER. He goes, she's a crackhead. I found her out on the front porch. She fell off the rocking chair. She's got an abrasion on her forehead. Yeah, well, and he walks out. Okay, and they test her, and lo and behold, she tests positive for cocaine, and she dies 14 hours later. 14 hours later. Remember what I said about cocaine? 2.5, 3 hours? Well, post-mortem, 14 hours later, she has cocaine present at 0.6 mics per mil. That's enough to kill her. And especially 14 hours later, if you go back to half-lives, that means she had greater than 1 gram per mil of blood for cocaine. Now we've told you story A. Story B, the boyfriend was a coke dealer, okay, and he wanted the baby this woman had. Now whether it was to get the baby away from the crack mother or something more nefarious, we don't know, okay? But we do know he wanted the baby, and he shows up at the house where this woman's renting a room, and there's an elderly couple there, and he says, "Give me the baby and I won't hurt you." And with that, the woman comes down the stairs, and he hauls off, bam, punches her right in the head. That's kind of a big dude. He's about 6'3", 6'4", 220 pounds, solid muscle. Looks like he might scare you people, but not me. Gotta laugh at that one. Okay, so he comes down the stairs, punches her in the face, takes her off. Truck driver comes up to an intersection, and he looks over and he sees in the grass there. He says, "What the hell's going on?" He sees this guy going down like this, down in the grass. He can't figure out what it is. All of a sudden, this woman raises her head and an arm. He goes, "Oh my God, that's a woman." And with that, this big dude hauls off and tries to field goal kick her head. Yes, she goes tumbling. Guy reaches over, grabs the woman, flips the bird to the truck driver, throws in the car, and takes off. Story 2. Okay, so it goes to trial. Now the defense, of course, was she overdosed on cocaine, not what my client did to her, because he didn't do anything. So how do you think we determined what happened? Well, unfortunately, it goes back to Quincy. Quincy did an episode where somebody was involved in an accident and a blood clot was formed. In this case, when he kicked her in the head, he formed a massive subdural clot. And the pathologist took that clot, and we tested it for cocaine. Guess how much cocaine was present in the clot? 0. None. There was absolutely no cocaine in it. So what does that mean? Well, she suffered the trauma prior to any cocaine. Since he was a coke dealer, what we believe, he went and got some cocaine rocks, put them in her mouth, and it went into her stomach. So the whole time she was in the hospital, the cocaine was being absorbed from her stomach into her blood, which what gave the post-mortem concentration. He's also a member of my fan club. Oh, well, I'll just end with this. Stoned again. You know, they're trying to legalize marijuana, and they started a petition for it. Just nobody can remember where they left it. And on that note, I will finish, and we have question and answers. Dr. Case? Are there any questions? Yeah, please.
About how many lightning strike deaths do you get in a year?
The question is, how many lightning strike deaths do we get in a year? Usually none. One year we had 4. That was back in the early 70s when there were 4 girls from a high school out in West County. They took shelter under a tree when it was raining, and that was a lightning strike. That same day, we actually had 2 other people killed. That was a very extraordinary day. In a normal year, we won't have any lightning deaths. In Florida, they have lightning strikes almost every day, and it is not at all uncommon. So when you go to Florida and you hear those warnings on the beaches, that really is true. I've been in places where there was actually a lightning strike and somebody died and it wasn't even on the beach. So it's a different kind. They have a lot more lightning. They have it every day. But we don't have many people here. Very few. Any other questions? Yes? Okay, the question is how many autopsies do we do a year and how many people are doing this? In the metropolitan area, we have 6 forensic pathologists, and they do all of the cases in St. Louis City, St. Louis County, St. Charles, Jefferson, and Franklin counties. The east side, Madison County and St. Clair County, is done primarily by one person, and then a lot of coroner cases are brought in. To give you an idea of how many people we're talking about, let me just use St. Louis County. St. Louis County has about 1 million people in population. Every year, about 10 to 11,000 people will die. Out of that, say 11,000 people, my office will investigate 8,300. We will autopsy 500. But we will investigate many more deaths than that. So there are 5 of us that do those autopsies. We do it on a rotational basis, and we're not overloaded. We can handle that number of cases. The investigation is done by investigators, and then I sign lots of death certificates. I do not autopsy 8,300 people a year. Okay. Any other questions? Yes. The question is that it takes 4 to 6 weeks to get back. When we do an autopsy, the body is released, and then we have toxicology, which takes, for a negative, takes anywhere from 2 weeks to 4 weeks, depending upon what their backlog is. We also have histology, where we make microscopic slides and look at that, and that could take, say, 3 weeks. If we have special studies, they may take a little bit longer. Most of our cases are turned around within 5 or 6 weeks if there's a positive toxicology. Wouldn't you say? Yeah. Any other questions? Yes. The question is, how do you get into the position of the medical examiner? The medical examiner is, thank God, not elected. It is an appointed position. We are appointed by our credentials, looking at what experience and training we have, and then in my case, the county executive, and actually it's done through the director of the health department, but then it has to be okayed by the county executive. So, and that is a common way that medical examiners are put into their position. Yes?
How much time is actually spent in the courtroom?
Too much.
Probably Dr. Long spends more time in the courtroom than I do. He has to go for many of the cases that he has not personally done an autopsy on, but they have been done in his laboratory, and they want his expertise. For the pathologist, when we do homicides, if they have a trial on that, then we're going to testify. I may be in trial several times a month. It's not every day. It's not even necessarily every week. Yes?
Dr. Vaughn, do you do civil cases as well as
Yes.
And do you have any on the science about the phthalate question?
You're specifically phthalates. Phthalates are present from all the plasticizers. They're interference in a lot of the assays. So it depends on what's actually being done in the testing. So you have to look at that and evaluate it. The phthalates should not interfere with one of the major drug classes unless it's a goofy laboratory.
On the ballot, this last ballot, we had a referendum on the limits on gambling, the amount you could lose at any one time. Am I expressing this correctly? And what do you think of the results of the passage of that would do to the suicide rate?
I don't know. I don't know. I don't have an answer for that. I don't know that. You mean if people gamble more, they'll lose their money and commit suicide? And people don't understand how common suicide is. We see, that's my bread and butter. We see it multiple times a day. It is amazing the ease with which people will end their lives. Many of them have devastated their lives through alcohol, drugs, bad behavior, criminal activity, and so it's just like one day they say, that's it, I'm out of here. Or we have elderly people or ill people that decide that they don't want to go through whatever they're going through. There are a lot of different aspects. We have some young people that just on the spur of the moment, a disappointment will tip them over to suicide. It's a very common thing. So I don't have any feel on the gambling thing. We see gamblers every now and then, and you know that's why they've committed suicide, because they'll leave you a note telling you that. But I don't have an idea of whether that has pushed up our number. We already have such a huge number of suicides. At least I can't note that. Any other questions? Yes. The education for a pathologist is you go to college, then you go to medical school, then you have 5 years post-medical school training to be a forensic pathologist. Dr. Long is a PhD.
Well, the PhD requires your basic college degree, and then whether you go for the master's or the doctorate. So you figure you're looking about 10 years. I have a real problem with that on multiple levels. Okay, first of all, the test. Secondly, there's a lot of stuff. You pick up the RFT, it tells you how to beat the test and the stuff you can buy and so forth. So it's not, I think it's a real question of personal violation of trust between the parent and the child. I'm not a big supporter of that. We've had cases where we've even done hair testing. And divorce cases, if you're unaware, are particularly ugly. And so one's accusing the other of doing drugs and getting the hair testing and so on. A lot of this stuff is really flimsy. It's not something I would ever take to court. I'm not a big proponent of that at all.
This for Dr. Long also. I'm what's affectionately called the chief date, and I don't drink.
Yes.
Half a drink. And I was having a conversation with a friend of mine who's a medical doctor, and I said, I wonder if I got pulled over and they took a blood test, would I come up as intoxicated? Because I'm symptomatic of intoxication, and I look intoxicated, but based on my weight, I should be able to drink like 2.5 glasses of wine or something before I get toasted. So I'm wondering how that works, and if I would actually test high if they were to actually take a blood test.
I love ladies like you. No, you wouldn't. No, you wouldn't, because the test is pure analytical chemistry. So regardless of the subjective effects, okay, the chemistry would say, no, you're not.
How do you test for gaseous toxins?
Well, you're talking about inhalants? Well, see, your brain, chemically speaking, is lipid. So it holds on to a lot of the volatiles a lot longer. So a brain sample will actually hold on to it. You can test that because you take a piece of the brain, you put it in a closed tube, seal it up, heat it, and then whatever comes off, you can analyze through gas chromatography.
Is there any way that you can tell through like damaged tissue if it was like gas, like what kind of toxin
Possibly, yes. It depends on the pathology. Like if you look at Tylenol, acetaminophen, it produces damage to the liver. It's called central lobar necrosis, which is a damage to the liver, and that's very apparent.
What would be the process, steps for processing evidence in a homicide? Let's say
Okay, the question is, how do we handle evidence in a homicide? For example, if we have a suspected rape and we do a rape kit, we take swabs and collect material from various parts of the body. What do we do with that material? Well, we package it in such a way that it has a chain of custody, meaning I sign off on it, and then another individual takes it, and that individual is the CSI person, the crime scene investigator. That is a person that you really should see on television. It is a police officer that is in the autopsy room with me while I am doing the autopsy. He is going to receive the evidence. He then takes it to the crime lab. In St. Louis County, for example, the crime lab is located in Clayton on Merrimack, right across from the courthouse. And they have all kinds of crime lab divisions there, hair, fiber, DNA, all sorts of criminalistics are done there. So that is where it is actually processed. Many of them are actually police officers, but then there are some lay individuals that work there. They actually do the analysis. It's not done by the medical examiner. Now, there are states where the medical examiner has, in their own department, they actually have a crime lab. They're in charge of the crime lab, but it still operates that way. It is not the medical examiner that does that testing. They turn it over to that laboratory. Yes?
Can you talk a little bit more about how you choose the 500 bodies that you autopsy? Say somebody drops dead, what factors do you look at to decide whether to autopsy?
The question is, how do we choose that 500 that we autopsy? And it's not that we set out to have 500, but that's usually what it turns out on a yearly basis. Though that list that I showed you, all of those people, all the homicides, the suicides, many motor vehicle accidents, many types of accidents, those people, for the most part, will be brought in and will have, if it's a homicide, they're going to have a full autopsy. In certain types of suicides and accidents, we may simply do what we call external examinations and toxicology along with radiology. If we can determine why they have died and we're fairly certain that it is consistent with the accident, we may not do a full autopsy. We do full autopsies on lots of natural diseases because at the age of the individual, we don't know why that individual has died. And we usually do that to people under the age of 50. We would like to know specifically why they are dying. Once you get over the age of 50, you can go ahead and die. It's like, I've worried about it for a long time now. Without further investigation, unless something is suspicious. Every office has its own age cutoff. And in Dallas, Texas, where they have a $9 million budget compared to my $2 million budget, they autopsy people up to the age of 75. We cut it off at 50 unless there's suspicious circumstances. Okay. Yes?
Is there a law that requires an autopsy, or can a family just say, no, we choose not to have an autopsy? Say someone, in their 40s or 50s passes away at home, and can a family just say, no, we don't want to do that? And, even if there was no evidence, or is there a law that requires that?
Yeah, the question is there a law that requires autopsy? And there is a statute that gives the medical examiner or the coroner, and in my case, the medical examiner, stipulation as to who we need to investigate. For example, certainly in a homicide, we're going to do an autopsy. I have the authority as the medical examiner to autopsy anyone who I feel needs to have an autopsy without family permission. That doesn't mean that I'm going to do that if the family expresses a desire not to have an autopsy, especially if they have legitimate religious reasons and objections. I will take that into consideration. If it is a homicide, I will probably have to do the autopsy, but I will be respective of their concerns. If it is not a homicide and I can go without doing an autopsy, even if I am not able to determine the cause of death, I will tell the family that I will respect their wishes not to have an autopsy, but on the death certificate, it will be signed as unable to be determined, And if there are any kind of insurance issues, we will not be able to address those issues without a cause of death. So as long as they understand that, I will honor their wishes. But if I need to do that autopsy for what I feel is societal reasons or public health reasons, I will do that. But I'm very respectful, I hope, of the family wishes. I do not do autopsies in this community. Families can't request us to do autopsies. There are private pathologists that will do autopsies for families, but the medical examiner here is not funded to do that. In Dallas, they have a very large budget, so they are able to, at request of families, do autopsies. But our county has never been able to do that. Okay. Yes? A typical autopsy, what does that consist of? It consists of the body arriving in the autopsy room. It is clothed in the clothing that it came with. The clothing is removed. In many cases, x-rays are taken of the body, and then an external examination is done where we look at the body very closely externally. We know descriptions like eye color, hair color, measurements, scars, tattoos, identifying marks. Any kind of traumatic injury is very, for example, in a multiple gunshot wound case, it may take 8 hours. It could take 3 hours, 4 hours, just to document those injuries. We then open the chest in kind of a Y incision and an incision that goes down the abdomen, open up the chest and the abdomen, and we look at the organs as they lie in situ. And we then remove the organs and examine each individual organ. And when I am doing that, I am trying to see, is there a disease process? Is there an injury? Is there anomaly? Is something wrong? So I'm going to look at everything. I'm not just going to focus on the heart. I'm going to look at every single organ and describe it and take tissue from it so I can make microscopic sections. I will also be taking blood, urine, various organs so that I can send those to Dr. Long in the toxicology laboratory for analysis for toxicology. I then open the head and look at the inside of the scalp, look at the skull, make a saw cut through the skull, take off the top of the skull, look at the brain, then take the brain out and examine it. And then I go to the airway, and that's usually the last part of my autopsy. So that's a pretty routine autopsy. There are additional things that can be done: removal of the eyes, removal of bones, stripping all of the soft tissue and looking at hidden injuries. But those are things that we don't do in a routine autopsy. What I told you is pretty much a standard autopsy.
It's 9 o'clock. Let's just have one other question.
Okay, right there. How did I get into this? Well, I always wanted to be a scientist, and when I was about 15, I decided to become a doctor. So I originally wanted to be a neurosurgeon. I liked the nervous system. When I went to college, I worked in I was at Mizzou, and I worked in the medical center, and I was in the pathology department, and I really liked it. I liked what I saw, as strange as that seems, and I was in the library a lot also, and I saw the pathology books, and I actually saw some old forensic pathology text. And as strange as it seems, I was very drawn to the fact that you could tell why people had died, and there were legal issues, because I was also kind of interested in the law. So it was that kind of medical legal investigation. So I was interested from that time, like sophomore year in college. When I went to medical school, everything was fun. All of those, pediatrics, OB, all of that is fun. But I always came back to pathology, and by the time I finished, I knew what I wanted to do and went into pathology, and we happened to have a medical examiner system here, and I was able to get into that work. And that is a very common story for pathologists, that they work in a laboratory. So it's not an unusual story. Okay, time is up. We thank you very much for your attention. You've been a great audience.